it deflated for certain things like suctioning? Is the patient over-sedated? If you gave your patient too much pain medication and they're on a spontaneous mode where they're supposed to be triggering their own breaths and they're suddenly not taking those breaths because they've had too much sedation, that can cause that particular alarm to go off. And a leak in the circuit. If somebody accidentally rolled over an IV pole over a tubing and cracked it and all of a sudden your air is leaking out of the circuit and not getting to your patient, you're going to have the same type of alarms. So now what do you do? As always, check your patient first. The first thing you want to do with these particular alarms, the low pressure, low peak, low tidal volume, low minute volume, is your patient disconnected from the tube? Did the patient turn around and pull it off by accident? I work in pediatrics, and kids know when they know how to disconnect their ventilator so that the alarm goes off and people come in the room. So that's generally what happens a lot of the time. So you need to always check for that. Is there a leak in the circuit? If the patient's connected and it's still alarming, run your hands along the tubing. Look for air leaking out. And if that's the case, you can change the circuit and eliminate that leak. We talked about a leak in the ET tube or the cuff. If the air is going around the patient's tube and not through the circuit, the machine is not going to notice that it's getting the air it needs, and it's going to alarm that the patient's not getting the adequate support they need. You need to reinflate the cuff, check the position of the patient, or if it's a cuffless ET tube, the patient can be repositioned to make sure that their air is going through the circuit and not just around the tubing. Is there a chest tube leak? This is more of a patient emergency, and you need to determine the causes of the chest tube leak, fix it, and get everybody in the room to help with that. And when in doubt, if you can't solve any of those, call your respiratory therapist. On the next slide, we can see some scalars that help you determine by looking at your ventilator, which I know as nurses we don't always do, is look at those scalars that are on there, but that can give you a really good clue as to what's going on. You can see in the first one,